welcome to The Different Sides of Learning. I am Shakira Rouse, the creator and founder of Special Compass. And this is an episode where we're talking about the different people that help students with learning disabilities succeed inside and outside the classroom. If it takes a village to raise a child, understand it takes a team to support exceptional thinkers. Today, I'm sitting down to getting to know a member of this team, and I'm talking with Rana Gupta. Welcome, Rana.
Good morning. Thank you for having me.
No worries. Thank you so much for being here with us. And I want to just kind of dive right into it. And so I want to know, tell us about your journey and what inspired you to become a speech pathologist.
Okay, well, I was very young. I had graduated from University of Waterloo. I was, at that time after graduating, looking and seeking what to do next. There was no jobs. A lot of my fellow students who had graduated that year way back were also in the same boat looking for jobs, and then most of us ended up looking for further education. And so I came from Northern Ontario, a small community, and at that time my parents had met a new couple that had moved up there, and the wife was a speech pathologist. So they encouraged me to meet her. Of course, I was very shy and nervous to do that at a young age, 21 years old. And but I took the courage and I met her. She was working in the hospital setting. We had a very small hospital. And so I had graduated from the University of Waterloo. She was quite eager to meet me, and I didn't realize, and I was more eager to meet her. And then that turned into a volunteer opportunity. I asked her if I could volunteer to learn more about our profession. She was glad to have me. And the first day her first patient came down, I was photocopying prepared materials for her. And her first patient that came down could not talk. He couldn't speak, he couldn't say a word. And he was in his early 50s at the time. And I was completely shocked because I didn't have any idea of what she did. She kind of gave me an overview in general, but it didn't mean anything until I actually was able to see this alive. So she explained then about strokes afterwards. And then I came to learn, because at a young age, and if you don't have any experience in your family, or we didn't have any relatives, we were the only, it was just my own family that was living up there, and we didn't have any relatives. So it was really enlightening. And I knew after the first day of volunteering with her, just the first day, I immediately knew this is what I wanted to do. Because I thought, I cannot imagine anyone, and it could happen to anyone at any age, that suddenly we are talking, we are functioning. This gentleman at the time was a CEO of a company, and now suddenly could not speak. Wow. And so the loss of communication is so devastating to a person, professionally, personally, in every way. And then it affects not just your ability to speak, but it affects your state of emotional well-being, everything. So just, your whole being as a human being, it is really devastating and life-changing. So that led me to seek a career in speech pathology, which at the time also was very difficult to get into. Only 2 programs in Ontario, wow. University of Toronto and Western. So this speech pathologist and I became very good friends, and she encouraged me to look into American universities. So in the meantime, I got my teaching degree at Nipissing University, because it was halfway between Southern Ontario and Northern Ontario. Yeah. So for me, it was ideal, and it had a lot of practical teaching practicums with it. And I guess I inherently like teaching, and I inherently like working with children, and actually working with adults and older people. So I realized that at least while I'm seeking and looking for the speech pathology program, I will get into teaching. So I got into the teaching program, and then eventually I got into the university in Michigan, and did my speech pathology. And then I really wanted to work with strokes initially. So my first love was strokes, and I got a position at McMaster University. And that at McMaster, that was like the biggest speech pathology department in Ontario. So everybody got specialized. There was 2 speech pathologists for each area of speech pathology. And there's so many different areas. And that's another thing I came to learn as well, that it's not just about adult neurology or strokes and aphasia. There's children, and there's language, there's stuttering, there's speech. There's so many different places you can work. So that was another reason that I was driven towards this profession. But when I went into McMaster University Hospital Health Sciences, I worked on the rehab program, and then I moved from working with stroke patients, and I was specialized on the stroke unit. Then I decided that now I need to expand my horizons so that I just don't stay with one aspect. Otherwise, it'll be too specialized. And I had an interest in working with children, so then I did some consulting in the school board, and having the teaching degree was also very helpful. Plus, I had a natural inclination for teaching. And then I went back into the hospital setting in community, smaller hospitals, including here in Oakville. And now, since the last 10 years, I've moved into private practice because it allows me not to be restricted into one area, but to be able to expand into all kinds of areas that I enjoy.
That's amazing. Really, really, really appreciate that. I love how you, first of all, I want to just kind of highlight like your journey and then your education, because you started out and graduated, at Western. And I think a lot of students, especially because I talked to a lot of students making that transition from high school to post-secondary, and sometimes post-secondary into the workforce, I think everyone thinks it's just one straight line until get into that career. But I'm like telling like all the students I mentor and I work with, I say, no guys, it's a river, it's flowing. You're gonna kind of just go in different directions. You'll get to your destination. You never know how, but I really, really, really admire that you shared that journey and how you volunteered, how you went back to school for more education, qualifications, and even how you mentioned about not being too specialized in one area and broadening your scope and your experience into other disciplines and areas. That's really, really important. So I really thank you so much for sharing that. I can't stress enough how important it is for others to hear about this, how people get into their professions.
Thank you.
And so kind of just touching back now, what is speech pathology exactly? Because you just even said that, and when you're at McMaster, there's many different areas you could go into. So kind of just like break it down to us a little bit more. What is it exactly?
Well, you work with communication disorders that range from young children, preschoolers, 2 years old, to adults. They can experience a wide range of communication difficulties. As I said initially, if somebody gets a stroke, then on the left side of the brain is your speech center. And if you get a stroke on the left side of the brain, that affects your communication. So you could range from losing entirely all ability to speak, all ability to understand, all ability to read and write. So that's quite devastating.
Yeah.
And so then you'd have to have a slow, you would need attention and therapy at the acute stage, meaning in the early stage. So the first 6 months of post-CVA means a stroke. Post-CVA, that's when your therapy is very critical to help you to recover. So that is one aspect, and then that's called like neurological speech pathology because it's affected an area of the brain. And then you can have the children who are taking time to speak. So they have a developmental speech delay. And so they're at risk. So early intervention is very critical for them as well. In Ontario, we have publicly funded speech therapy up until the age of 4 years old. So now a lot of physicians have learned, because there's quite a long waiting list for children in the publicly funded system, they often refer to the private speech pathologist to provide some guidance to parents while they're waiting to be seen. And then there is speech pathology in the school board. And so that's school-age children. And so the children who move from 4 years old to 5, maybe they still have difficulties saying certain sounds, that's articulation, being able to string words together to make meaningful sentences, or maybe they just don't understand a lot of things. And they may have receptive language delays. There are kids, of course, everybody in the public is aware, and everybody who I see at a young age, they're afraid that their children might be on the autism spectrum.
Yeah.
There's a common feeling of worry around that.
Yeah.
So if the child has a delay in communication, that's the first, sense of fear that often parents have. So between 4 and 5, when they go into JK, SK, then the speech pathologist may be involved to check and screen and see how they're doing. But a lot of children at that age, moving from SK to grade 1, that's a big jump, because all of a sudden now you're more into a classroom, more into academics. You jump from play to learning how to read and write.
Yeah.
Right? There's a lot of play up to SK. So then that jump from SK to grade 1 is very big. And so the children who have had any history of delayed communication, speaking, reading, writing, understanding, that could be significant in their learning. And so those children, you want to watch and follow, and parents may notice things, especially more so by grade 1. And then sometimes children by grade 2, if they're experiencing greater academic difficulties in the classroom, and it could be for language delay, it could be that they have ADHD, maybe they have a history as young children of seizures. There's all kinds of different contributing factors. And so those children may be, at risk academically, and so they need more support for their reading and writing and language. So you've got young children, preschoolers, you've got school age, and you've got adults. Wow. So, and a wide area, school board, hospital settings, community, and I think I've covered, and private.
Yeah, that's a big, a big wide umbrella of everything. And I think this is also my interest too, in terms of neuroscience and how the brain functions and works in certain aspects, because I think we know the importance of the brain, but I don't think we realize the magnitude of power it holds. And just a little thing like you're saying, if you have an adult, for example, had a stroke on the left side, and it could cause a communication disorder, and that intervention window is very important. A lot of people don't realize that. So I think this is also very good knowledge to understand, hey, this is being a speech pathologist is a big role, but also, the brain is very powerful, and there's a lot to really kind of digest and uncover here. So I want to kind of go back to, you're talking about the students, and maybe of a delay in language can also connect with their reading and writing ability. So what is that connection right there in terms of how you would help a student that may be that may be just showing symptoms of reading or writing problems? How would that work?
Well, it would work like this. For example, I can give you examples. So if I have a child who is, for example, working now in SK, moving into grade 1, but he has a history of language delay. So it takes him time to understand things. And language is quite a wide ocean. It's really not something that people, if I say, oh, well, their receptive language is below 50%, or their expressive language is below 50%, well, to intervene and to help that child to build up their language skills, it's not that tangible. It takes time. And then the child, maybe in 2 years later, you can retest and see how they're doing. But they have, you will give recommendations of, how to build up their language skills. But if they're having difficulty understanding, they're also likely to be at greater risk also to learn new information and new skills. So in this example, when I know that the child is moving from SK to grade 1, discussion with parents led to maybe we can teach him also something about reading, which is concrete, much more concrete. Mm-hmm. And through reading, as he develops his reading skills, then he will build more language skills because he'll be reading about things and he'll be able to. If we don't work on that, he's going to be at greater disadvantage in his language as he gets into grade 1 and grade 2 and his reading. So what I do for reading is a very concrete, direct instructions, very systematic. So teaching the sounds, they must know their sounds, and then they must use those sounds and have sound symbol correspondence, then learn the vowels, move to the words, then move to the sentences, and it's a lot of direct teaching. And other children, for example, who might be, I've started seeing them maybe in grade 1, can't read, grade 2, they can't read. Parents might be on and off, again, direct, systematic approach, but they may have a history of this young boy has ADHD. So then in the process, it takes time, maybe by grade 2 or 3, that he gets further testing, and then maybe some medication. Now, not everybody wants medication. I'm not saying medication yes or no, but if there is that need for medication, it may not come till a little bit later. And for example, in this case, this boy, he got a psychoeducational assessment done by grade 3. And then they also confirmed that he had ADHD, and then the parents did choose to do the medication route. And you can see a very big difference in this young boy when he's on medication, when he's not, in terms of his focus. And for reading, you need focus. So I not only take a very phonetic approach and direct and systematic approach to the reading, but I also do apply strategies that are customized for the needs of the child. So if that child needs chunking, I will say, like bits and pieces at a time, I will give him bits and pieces. I'll give him that reinforcement. And then if they can't sit still, then I encourage them and give them a little bit of relief with a little bit of a game or some activity that they like for 1 minute in between. And then they're more motivated to continue. So you have to kind of analyze the child's response and needs and work with that as well. So that boy started and resumed again in June. I hadn't seen him for several months. So he's an example where parents since COVID could not get a refill on the medication. And then when I started to see him again, he could not sit still at all, could not focus at all. And then a week or 2 later, they were managed to get the medication because they could see the difference. And then when he got the medication, I was able to get him to focus maybe on 1 page and then say, okay, here's a little game, and then the next page, and then the next page. And then with that built-in reinforcement, he made so much progress in 1 month. So it's incredible. But again, you have to kind of read the child, how they'll respond. It's not just about us thinking what we think is important for the child. We have to look at the child as a whole child.
Yeah.
And kind of encourage and engage them into the process. Otherwise, no gains are going to be made. Doesn't matter how much you put up there.
Yeah, that is 100% true. I think a lot of people don't realize that when it comes to teaching children, they're, we could teach them their ABCs, 1, 2, 3s, but there's things before that learning process start that have to be, that also are going to impact that learning, the process. Exactly. And usually, I know you and I had a conversation about this, like usually those are the things that would hinder the learning process. So one of the things I tell people in my presentations, one of them is the impact of stress, right? If someone's stressed, doesn't adult or child, and then you'd say, okay, complete this test, do this homework, that's not going to happen because their mind is occupied by something else that they can't process what's in front of them. accurately and
Right.
properly. So this is very, it's good to hear this and let others hear this as well too.
Yes.
So my next question for you is, because you were talking about like the signs of, you know, how some doctors are giving parents referrals at the age of 2. So in terms of like child development, what are some signs of like, I should say, don't want to scare anybody, but what are some signs of like maybe a delayed in speech that could cause a yellow flag to say, hey, maybe this is something we should kind of monitor and kind of be
Yes.
on the lookout for?
Right. Well, okay, that's a good question. And so if the child at 2 years old is a good marking point, although sometimes now they're even starting to refer earlier. But I have said to a couple of people already, I think better to wait until 2 because, you know, give the child a chance, 18 months, 19 months, the child really develops. There's a lot of development that goes on each week, each month when they're so little as babies. But by the age of 2, you can at least start a baseline. And you can say, okay, they're having some eye contact, they're looking at you. You can look at some nonverbal, you know, cues and see how they're communicating. Oh, well, they're able to gesture. They know what they want, but they're not able to express it. Oh, well, they have 3 to 5 words. Okay, well, that's good. So we'll make note of all that during an initial consultation. At least I will. That's how I do it. I take that approach. I don't actually see the child individually for therapy at the age of 2 because they can't sit still. And, you know, it's only natural. They should not sit still. They should explore and enjoy. But the parents have them all through the day. So I provide more parent training and strategies of what they can do. And the idea is to do a lot of face-to-face, do a lot of modeling with your voice, use a lot of early sounds, like the front of the mouth sounds, P's, B's, M's, W's, all those the child can see. And that can help. And with some music, they all respond to music, sound, and encourage that kind of stuff. And then help to build up the language skills that way, or build up their word levels. So if the child doesn't have, you know, doesn't make very much progress month to month, because between 2 and 3, that's your greatest developmental period. So I say to parents, start trying to watch to see if you try using these strategies that, you know, 2, 2.1, I count in months. So 0.1, 0.2, 0.3, 0.4, like that. You should start to see some changes, some improvements. But if we don't see any change, let's say in 3 months or in 2 months, no change, well, then we may need to do a little bit more because, you know, by between 2 and 2 years old and 2.6, 2.5, you want to see an increasing emergence of words.
That's a really, really good tip. Thank you for sharing that, because I think that I know that in many different areas, you know, child development is an important stage in human development. And I think sometimes whether you're a new parent and kind of just you don't know what to expect, I've noticed that a lot of times parents can be kind of a little bit anxious. Hey, they're not walking yet. They're not crawling yet. Is this normal? Is this normal? Their teeth haven't fully come in, you know? So, and because development is different from every child and every individual, it's kind of hard to kind of gauge to say, hey, when is this normal versus when is this, hey, we should kind of be now paying attention. So I think that's like really good tips for parents out there that, you know, are not too sure what to look out for in terms of, hey, is this a yellow flag that we should be concerned of?
Yes.
My next kind of question, because this is my final question actually for you, is about early intervention. So I know that in this, not just with speech pathology, but even helping students with learning disabilities and other exceptional needs, intervention is a term that's used a lot. And when it comes to early intervention, what is that exactly in the realm of like speech pathology?
Well, I guess early intervention, as we say with the 2-year-olds, 2 to 4 or 5, that's early intervention is doing therapy or guiding parents, providing parent education, what they can do at home to facilitate increasing communication. Your academics really depend on the strength of your communication skills and your language skills. So if everything is increasing and you're developing and speaking in full sentences very quickly, you're understanding everything, then you have greater chances academically when you go into school. So that's why early intervention is important. It's the foundation. Your speech and language is your foundation for everything else. And early intervention when it comes to adults, of course, is that the brain has some kind of an onset that is critical, and it critically affects your communication. So early intervention in that realm is very important because the brain is healing. So it's during that time that you make the greatest gains, as opposed to waiting and hoping that you will either outgrow something or things will change. It's always better to have some form of intervention or guidance or teaching or training than have nothing.
That's really good. Thank you for that.
Right?
Yeah.
Yes.
I think I've heard that a couple of times with parents too. They're kind of just like thinking, oh, they're gonna pick it up. They're gonna grow out of this.
Yes.
And here we are, like 2-3 years later, they're still in the same spot.
Yes.
And it's not that things are impossible at that moment time, but it's a little bit tougher. So
much tougher.
Yeah.
Right.
So yeah, I think this is really key here and about early intervention. And sometimes it's like you said, it's just guidance to kind of help them along to progress to a place where they could develop strong communication skills. I think that's important.
Exactly. And if I can add one more thing, another example of children who maybe they've developed more communication, then they start school and then they start experiencing more academic difficulties. And if they were seen for a psychoeducational assessment, which may or may not have a language assessment, then you would need a speech pathology. Like in the school board, for a psychoeducational assessment, you need a psychologist and a speech pathologist assessment combined. So some people get it done at the school board, but it may take a couple of years to even get one. So then they'll go externally and get one outside the system, but that may or may not, depending on the psychologist that does the psychoeducational assessment, that may have a language component or they need the speech pathology language assessment. The point of my mentioning this is that if a child goes in at grade 1 and 2 and already has weak language skills, but appears to be handling things and for the most part can make sentences and tell you a little bit of a story, then parents think everything is good to go and everything is great. But then another red flag is that they may be having difficulties at school. And then that's the academic side of it. But the reason that they may be having difficulties could be related to that language component. So what happens often is that if the child has an assessment and it shows very low or weak language skills, expressively, receptively, whatever, in their grade 1, 2 range or grade 3 sometimes, that has major impact quite often as the time goes on, because each grade level, your work increases in terms of length and complexity and independence. So by grade 4, they're expected to do more independently. They're expected to do more. So children who are not receiving the supports that they may need or could benefit from, then it becomes very difficult. So I have a student right now, for example, who had the psychoeducational done in grade 5. And even though she had a language assessment done in grade 2 to reveal, her scores were quite weak. And so by grade 5, then the parents pursued psychoeducational. And now the child is going into grade 8. But really, according to her assessment scores, and even according to the child, she's having a lot of difficulty. And the grade 8 curriculum for her is very difficult. And her ability or performance comfort level is more at grade 4 level.
Oh, wow.
So the gap gets bigger, is what I'm saying. And it's always better for parents, even if they don't know, they're not sure, as most parents would be, not sure, not knowing what to do. It's better to get some advice, some consultation, versus none at all. And then that might give you at least a little bit of direction. or sometimes peace of mind.
Yeah. And
Yes.
I think that's important. I think because a lot of the parents that I help and work with, I think that's where they're coming from. They're coming from a point where they want peace of mind, or they're
Yes.
looking for direction, because
Right.
it's a lot. It's a
lot.
to
Nobody really knows, and nobody knows how to guide them because everybody's so busy in the school system, and teachers are more inclined to do curriculum. As I know, having gone through teachers college, they're there to teach the curriculum. But the speech pathologist role is different. They diagnose, assess, see what the issues are that are contributing to the academic difficulties.
Oh, that's beautiful. Well said.
Yeah.
So thank you once again for
Yes.
taking the time to join us today on the different
Thank
sides.
you very much for having me. It's a pleasure. And, you know, I encourage people who are interested in this field. It's always a learning in this profession. You're moving from adults, learning about strokes, learning about swallowing disorders. Then you move to children. You have to learn about the reading, the writing, the academics. It's always a learning profession.
Oh, that's amazing. That's really good. Keeps you on your toes, keeps you
Yes.
busy. There's always something new. I love that. I love that.
Yes. Yes. Well, thank you very much for having me.
No worries. Thank you. Just to kind of, I guess, if anyone, do you have a website that anyone could check out if they wanted to learn more about your work?
Sure. It's www.aspirespeechpathology.com.
Well, thank you so much, Rana. So if you're interested in learning more about Rana's work, you could check her out on her website, which will also be in the show notes later on. And thank you so much for tuning in to the Different Sides of Learning, and we'll chat with you next time with a new episode and a new member of our team. Thank you so much.
Thank you.